Hello everyone. Today we will see the working of LDL reagent. The kit is by Biolab Diagnostics. The kit contains one bottle of R1 reagent, one bottle of R2 reagent, and one bottle of calibrator. Please note that the concentration of calibrator is lot specific and the concentration may change when you open a new kit. We recommend all users to read instructions for use before using the test. Apart from this, you may require additional items like pipettes, tips, timer, etc. Before the procedure, let us understand the preparation of working solution. Reagents R1 and R2 are ready to use and they do not have to be mixed with each other prior to running the test. Mix 500 microliter of distilled water with the calibrator. Mix it thoroughly and keep it for 10 minutes. Reagent volume is 750 microliters of R1 and 250 microliters of R2 and 10 microliters of sample. Now we have to take 3 tubes, one for blank, one for calibrator and one for the test. Put 750 microliters of R1 in all 3 tubes. In the first tube, you can add 10 microliters of distilled water. That is not compulsory. If you don't add distilled water, it is okay. In the second tube, add 10 microliters of calibrator mixture which was reconstituted earlier. In the third tube, add 10 microliters of patient sample. Incubate for 5 minutes at 37 degrees Celsius. Now put 250 microliters of R2 reagent in all 3 tubes. Again incubate for 5 minutes. So as explained earlier, we will take 500 microliters of distilled water and mix it with the calibrator. Kindly take a note of the calibrator concentration. It can change from batch to batch. Mix it thoroughly and keep this mixture for 10 minutes. Now take 750 microliters of R1 reagent in all 3 tubes. Now, as per our procedure, we are using 10 microliters of distilled water for the first tube of blank. Kindly note that this is not compulsory, and if you don't add distilled water, it is totally fine. But since it is mentioned in our procedure, we are adding it. Make sure to change the tips for calibrator and the sample to avoid contamination. Wipe the tips using a tissue paper after use. Now we are using 10 microliters of calibrator mixture which was prepared earlier and putting in the C tube. Now use 10 microliters of patient sample and put it in the tube marked as T. Mix the tubes thoroughly. Incubate the mixture for 5 minutes at 37 degrees Celsius. Now put 250 microliters of R2 reagent in all 3 tubes. Use a different calibrated pipette for this. Mix it well and again incubate for 5 minutes. You will see the change in color. Program LDL on a semi-automatic biochemistry analyzer. As you can see, we have already done that here. Run test LDL. Aspirate water as you can see. Now the instrument will ask to aspirate reagent blank. Aspirate reagent blank. Make sure to remove all the tubes after aspiration. After a small lag time, the instrument will record the absorbance. Save these values. Now the instrument is asking to aspirate standard, so aspirate the tube marked as C for calibrator in our case. After a small lag time, the instrument will record the absorbance and factor. Aspirate the same tube again to get the standard concentration. Now after the delay time, we will get the standard concentration. The standard concentration is 76.92. Now you can aspirate the third tube marked as T, which has the patient sample. Now we will get the patient values. The patient values are 116. For expected values, kindly refer the literature. Thank you.